Hello, welcome back. In this video, I wanted to do a quick scan review of a crown case and talk about a little bit of the adjacent dentition as well. So this is obviously an iTero scan. This is a scan that we did immediately after we prepared the tooth. You can see it's tooth number 15 that was prepared for a crown. This is what the scan looks like. And I want to kind of walk you through my crown prep design and then show you how this image translates into the Glidewell Fast Mill software, Fast Design software. So number 15 needed a crown restoration a little more urgently than 14, but it looks like 14's in the same boat. We've got a failing tooth color filling with some fractures, a little bit of recurrent decay happening in multiple areas. If we turn on the actual imaging, you can see what that looks like. From a decay standpoint and the fracturing standpoint that's happening there on 14. So 14 definitely needs a crown in the near future. 15, of course, is also in the same boat. Let's see if I can get to the distal just a little bit. Looks like that doesn't want to allow me to move distally. Anyway, both of these teeth were in need of crown restorations. So from the crown preparation standpoint, my process, as I've mentioned in many other videos, is generally a pretty routine crown prep. Numb the patient, remove any decay, narrow, shorten the tooth. And these are things that I usually tell the patient too, so it's not a surprise to them. And so they know the process. I use usually an 856-016 tapered end diamond, a rounded end diamond, a tapered diamond. And I'm preparing for zirconia. Now, this prep will also work for Emax or lithium disilicate and for a lot of other materials, but you can see here, there's a healthy amount of reduction there. Nice smooth margins as far as I can tell here. We did place a core buildup. I like to use Luxacore Z. It's got a zirconia component to it. It's if you ever place one of those and then go back to trim it, it trims a little more difficultly, and I think it's because of the zirconia component, so it's a very durable material. I'm using Optibond, which I really like, Optibond adhesive from Kerr. It's been great, low post-op sensitivity compared to some other stuff I used. Potentially that's operator error. Anyway, here's the prep. Like I said, I also recommended a crown for tooth number 14, but for this one, just number 15. So when we scan through iTero, and I'm excited about that new iTero camera that's coming out, very excited. It automatically, when we set up the case, we set up the RX so that it automatically sends this case directly to our lab down the hallway, where we can manage and manufacture the crown. So here is the crown in the Fast Design software. Let's see if I can get my controls going here. Come on out, there we go. So it's not, looking at this image, it's not as... Sorry, my controls on my MacBook are not wanting to cooperate. It's not as smooth as I would have liked it to be. So in retrospect, yes, I would have smoothed some of these edges, made sure they're not sharp angled edges. With Bruxer, they call for a 3mm retentive prep with a minimal taper if possible. So I always endeavor for that. Now, if you have a less than retentive prep, sometimes I'll put in a retention groove. I like to put in a central divot, a little depression right in the center. That's a couple of millimeters deep to allow for that crown to seat and orient ideally. But this is the prep as it came through, from the scan. So let's zoom out a little bit if I can, and I'm going to turn on the crown. So here's the crown that was proposed by the Crown AI. Really nice proposal, no issues with the design and the pathway. We can turn on the opposing arch, and then I'll roll it over here and see what it looks like. I always like to finish my inspection by looking down this buccal corridor. Sometimes you get a cusp that's sticking way out or hanging way down. Like you can see here, tooth number 14 is kind of distally oriented there, and that distal buccal cusp could create some challenges for this patient. So when we design that crown, I'll probably design it with less of a cusp there, just to reduce the risk of some sort of a working or non-working interference. Assuming there's no high pulp horn, I don't think that's a very good risk or a very high risk for a root canal. Anyway, so, pretty routine case, pretty simple. Let's turn that lower back off and look back up at this upper tooth. One of the things I like to do when I'm designing, especially when I'm marginating, let me turn the crown off, is I turn off this smooth. So it gives us a little bit more detail about your margin. Now let me turn it on and off and you can see it. Here's not smooth, smooth, not smooth, smooth. So sometimes that helps me when I'm going through a design process to identify the margin. I don't use a lot of cord, I use a lot of viscostat. I find if I'm the one marginating, generally these margins are easy to find. Once in a while I'll have one of the assistants do the design and the margination, and they do just fine as long as the margins are clear, but a lot of times I'll have to give them some input. So the key, just like with other design processes, is to make sure that you're looking at that margin from different angles. Because a lot of times, the light, the artificial light that's coming in on the screen will give you a different view of where the crown meets the tooth. Now, if you're using cord or retraction paste or something like that, usually this is a non-issue. I personally don't like to subject my patients to a lot of cord or retraction paste if I can avoid it. And again, I haven't done it for many, many years, and I feel pretty confident in our process. But illustrating what the smooth looks like in this software, there's smooth, there's unsmooth. I think the unsmooth is a little more precise. We can disable the color as well, which in my opinion makes it more difficult to evaluate the margins. But what's interesting is many labs, when you send them a case from a digital scanner like iTero, will receive a monochromatic model. So there's no color. So if you're ever wondering why sometimes, especially if you don't pack cord or have a clear margin, why you get a margin mismatch even in the presence of a digital scan, this could be why. It's hard to see. Because here you can see the margin. Even here on the palatal you can see where that enamel edge is. But oftentimes, if there's no coloration on the model, it's hard to see. So there's some curvature indication. This basically is an algorithm that tells you the extent of the curvature in these areas. I don't find this particularly useful, except for identifying where I could have potentially smoothed the prep more. You can see these areas have a really heavy curvature, which means they're sharper, but I don't normally use that much. I tend to toggle this smooth on and off. The crown itself, bonded in place. Turn that smooth on. We are using Maxim Elite. Really like this stuff. You got to be careful. It cures really fast, so you got to be very deliberate about your cleaning process. Anyway, let's go back over here. So pretty routine prep, core buildup and crown. We always image before we place the core buildup, take a photo, an intraoral photo before we place the core buildup so that the insurance can see that. And then if we ever need to, I can grab a snapshot from the iTero scan just to demonstrate that we did the core buildup and why we needed it. So hopefully this has been helpful. Pretty routine case. This is what we do 6 to 10 times a day. We get to the point where it's pretty routine, like I said. I try to keep things exciting for the patients, not from a scary, exciting standpoint, but giving them an opportunity to see the process. We'll take them into the lab and let them watch the machine, so it's helpful and they can kind of enjoy that. Oftentimes they're taking videos and recording and taking pictures, and that's helpful, to spread the word that we're doing, high-end, up-to-date advanced dental care. Not to say that this is better than any other dental care, but it sure is a good way to spread the word about technology we have in the practice. So thanks for watching. Let me know if there's any questions. See you in the next video.